anterior branches of the thoracic spinal nerves don't form plexuses. They are exceptions from the rules. We know that others form plexuses, yes? And the anterior branches of the thoracic spinal nerves called intercostal nerves. Where are they located? They are located together with intercostal vessels. Where is better? Together with intercostal vessels. Together with them, they go along the sulcus coster. First of all, they enter the space between internal intercostal and external intercostal muscles. They are covered with pleura. This is parietal pleura. The superior six get the level of sternum. The inferior six, they get the level of the rectus abdominis muscle. The last nerve is called subcostal nerve because it's not between ribs but along the inferior border of the 12th rib. Therefore, it's subcostal nerve. All of them form muscular branches and also the cutaneous anterior and lateral branches to skin of the abdomen, thoracic cavity, and mammary gland. The muscles which are innervated are mainly deep autochthonous muscles of back, thoracic cavity, and muscles of abdomen. Lumbar plexus. Lumbar plexus is formed by the anterior branches of the first four lumbar spinal nerves located inside this muscle. It's also major muscle, and it's located on the transverse processes of the lumbar vertebrae. The branches of the lumbar plexus are the following branches. The first that goes directly beneath the subcostal nerve is called the iliohypogastric nerve. Enters the space between internal oblique muscle of abdomen and transverse muscle of abdomen to innervate them, of course, and terminated in the skin of hypogastrium. It's above the pubic symphysis. A little bit below, we'll get one more nerve. It's called the ilioinguinal nerve, nervus ilioinguinalis. In the beginning, it has the same direction as the previous iliohypogastric nerve. It enters the posterior side of the inguinal canal and terminated in the external genital organs, skin of labia pudenda majora and scrotum in this region. The next nerve is called the lateral cutaneous femoral nerve. We'll find it at the level of the superior anterior iliac spine, where it penetrates the wall of abdominal cavity and terminated in the skin of thigh, the gluteal region, this one. One more nerve is called the obturator nerve. Obturator nerve goes through the obturator canal and directed to the adductors of thigh to give also branch to the obturator external muscle and to the hip joint too. On the anterior surface of muscle, there is a genitofemoral nerve, divided into two parts, genital and femoral. Genital gets the content of inguinal canal, goes inside this canal. Femoral directed beneath the inguinal ligament to the region of thigh. And the biggest nerve of this plexus is called femoral nerve. Femoral nerve is the biggest one to go through the lacuna musculorum and located between the anterior group of the thigh muscles to innervate them. The biggest branch from the cutaneous part of this nerve is saphenous nerve, together with great saphenous vein, passes through the adductor canal wall and terminated in the cutaneous region, in skin of the anterior and medial aspect of leg till the medial side of foot. Saphenous nerve. The muscular branches, as we said, they innervate the anterior group of the thigh muscles and also make anastomosis with the obturator nerve in the medial group of adductors. It was lumbar plexus. For this topic, you should repeat muscles of pelvic girdle, muscles of thigh, muscles of thorax, abdomen, and back. All the muscles should be repeated. Do it, please.